I guess you've heard that in Norway they have free healthcare. Well, I'm Norwegian, and I can tell you that that's not true. Here in Norway, we don't have healthcare. We have what I would like to call sick management, because it's not even sick care. And my experience is that they don't care about your health. So here in this video I would like to share my experience as a Norwegian that has had to deal with the so-called healthcare system. First of all, there is no such thing as a free lunch, you know. We pay for the healthcare, so-called healthcare system with our taxes that are very, very high here in Norway. And secondly, as I get older, I have started to think about, you know, what if I end up in an old people's home, as they call it. I don't want that, because the old people in those places are not being looked after properly at all. And it's a big shame, if you ask me. Now, when I was 8 years old, I started, excuse my language, pissing blood. And I was put in a hospital. And I stayed in the hospital for 1 week. And nobody told me anything. And I didn't know what was going on. And honestly, I thought I was dying. And then the bleeding stopped. And for a very long time after that, I was still in the belief that I was actually dying. My parents didn't say much either. Maybe they didn't know. And after that, a few years after, you know, I started limping because one of my legs grew shorter, and I was then put under massive amounts of radiation, X-ray, and all of that. This was in the late 70s, no, early 80s, the radiation. All my life, I've had to pay for adjustments of my shoes and so on, because I'm a few millimeters short of, I think it's 2 centimeters. And if you have a 2 centimeter length difference in your legs, the state will cover the costs of adjusting your shoes. But I'm luckily less than that in the length difference. But the point here is that the state thinks that it's fine. You don't need to adjust your shoes if your legs are like 1.9 centimeters, have a 1.9 centimeters length difference. And I can tell you, I have 1.4, 1.3, 1.4. And I can tell you, you're going to have immense back problems and pain your whole life if you don't do anything about that, you know. But no, they will give you painkillers and also antidepressants instead of helping you deal with your issues, the root of your pain, or the cause of your pain, which is very typical of the Norwegian so-called healthcare system. They say that, you know, your Scandinavian countries are the happiest countries on earth and all of that. Okay. Look at consumption of antidepressants in these countries here. It's astronomical. Why would people need antidepressants if they're so happy? I'm just throwing that question out there. So no help from the healthcare system there with my back, my legs and all of that. And then I believe I was 24. I was hit by a car. No fault of mine. I was just hit by a car, broke my neck, and all of that ended with me having to pay my lawyer for losing the case against the insurance company that refused to pay me any insurance money. And of course, I ended up with quite a lot of debt added to my student loan, because higher education is free in Norway. No, not well. Some of the some of it is, but if you want to, have an MBA in MBA, that's Master of Business Administration. That kind of education, it's not for free, usually. Now, it's not my intention to walk around here in the woods and complain, but it's important that people understand how it works here. Because I see in social media quite often that people, probably from other countries, they typically left-leaning people, they write that, in Norway, in Scandinavia, they have free healthcare. And I'm here to tell you that it's not entirely true, A few years after, basically immediately after I had my accident, I started having migraines, and those got progressively worse. And I've had to deal with that my whole life. I am now in treatment for that, because I didn't get any help from the Norwegian so-called healthcare system dealing with that. They will give you painkillers, which I will admit that I really need sometimes, but to deal with the underlying issue, you don't get any help. I've paid thousands upon thousands of kroner, and you can add a zero there, so thousands upon thousands of dollars in physiotherapy and things like that, and up through the years, just to keep it in check. And it's not for free. They won't help you. They won't help you. The healthcare system here, they don't care if you have, if you had a broken neck and now you have a migraine for the rest of your life. They don't care, because it's all about sick management. And if you ask me, they don't really manage your sickness very well either. Now, I am in treatment now. It's a doctor's team, medical professionals. Anyone out there who can guess which country that team is, where that company or that team where they are from. It's an international team, but the company is based in, guess which country? Yes, the USA. And I'm very grateful for the help that I'm receiving. That was, of course, not for free. It's quite expensive. But you know what? I would pay double of that, triple of that, because now I'm actually getting help with the underlying causes of the pain. Norway is a beautiful country, and I really, really like living in Norway in that regard. but don't get sick here in Norway. Because Norway is a country where you will be doing quite fine, I guess, if you don't run into problems, health problems. And it's for me it's been a struggle. For me it's been like I just at one point I had to conclude that I'm not getting any help from the public healthcare system, so I'm going to have to fix things myself and pay for that out of my own pocket, while also of course paying massive amounts of taxes for the so-called healthcare system that is not helping me at all. And some will write in the comments that, yeah, well, you just said that you spent 1 week in hospital when you were a child. And that's true, and that was paid for by the state, aka taxpayers' money. And I ended up with being traumatized for life from that experience. I remember breaking down mentally one day in hospital. You know, I was 8 years old, crying and all of that. And yeah, you are allowed to break down and cry in your hospital bed. In hospital, that's allowed. So don't come to Norway if you're if you have some health issues. Don't come here. Now I don't know how the health care system works in other countries, because I don't have any personal experience with that. I've heard that in the USA it's you know, if you break a leg you end up with a hospital bill that is just astronomical and all of that. But to the people who are saying that the healthcare system in Norway it's for free healthcare in Norway, you're lying. Either you're lying or you don't understand basic economics. Now, of course, I mean, it's not all bad, you know. If you have something that is easy to define, like a heart issue, I guess, or if you break a leg, they will fix that, you know, and the state will pay for that, or us taxpayers will pay for that. Now, I'm not an expert on the healthcare system in Norway. I'm not a doctor. I'm just sharing my experience here, and for me, you know, I haven't gotten proper help with my health issues up through the years here in Norway. I just haven't. And I think that people should think twice before coming to Norway if they have a health issue. As I said, we are consuming massive amounts of antidepressants here in Norway. Well, I'm not, but well, if you know, for some, I'm not saying it's wrong if you have I'm not a doctor. Sometimes I guess that's what you should do, but you know, this is not medical advice, obviously. Just saying that it's like, no, the healthcare system is not so great, and it's not for free. People are saying that should stop lying, and I'm sick and tired of hearing and seeing on social media people who are claiming that, oh, it's for free, and you know, and all of that, because it's not. So yeah, that's basically what I wanted to say. And you know, to all the new subscribers, wonderful, thank you for subscribing. Thank you for your comments on my latest video. It's great. Norway is beautiful. I love Norway. I'm very proud of being Norwegian, which is a funny thing because I was born here. I didn't do anything to become a Norwegian. It's not an achievement, you know. But anyway, that's all for now. Thank you for listening.